Hey guys, welcome back to my channel. I wanted to do a video real quick. I'm doing a handheld video again. I told you guys I'm visiting my son. If you hear the background noise, we've been in there watching Reno 911. He's law enforcement and still one of the funniest shows ever. So that's what we've been doing today. Wanted to talk to you guys a little bit. I feel really good today. I've been able to tolerate something like regular soups and stuff. Ryan and I have gone out to eat and stuff, and last night I had chicken tortilla soup with no chicken. There was no rice or anything like that, and it was just broth and little pieces of chicken. My hair is ridiculous right now. So I was able to tolerate that really well. And I know it's kind of early, but I wanted to try and be able to not have to take protein shakes I'm sorry about the hair, not be able to have to take protein shakes into restaurants and stuff like that with him. And then today I had a really great soup from a place that's here in Arizona, which was like a curry and beef barbecue, but it was really like teeny tiny pieces of beef and like a vegetable broth. It was really good. So I've been really careful about chewing up and making sure that everything's pretty much mush before I swallow it. I don't know my weight right now. I decided to not weigh myself in the first several weeks. I want to be shocked, I guess, when I go to the doctor's office on the 16th and see how much I've lost. I can tell how much I've lost. I actually we went shopping yesterday and today. My stamina is great. I've been able to keep up with him, not have to sit down, not have to rest. So I'm feeling really good. I haven't had any, and I'm been out in the heat. We were shopping outside in an outside mall today. So, I'm feeling really good, but I did have a little bit of a complication yesterday that ended me up in the emergency room. Thankfully, as a nurse, I knew the symptoms of a blood clot in my body, and I actually have one in my arm at my IV site, and it is called a superficial thrombophlebitis, which is not due to my traveling. So I just want to make sure that I clarify that up front. This is a superficial vein. It's due to the trauma to my vein when the IV was placed. And I wanted to just show you guys what it looks like so that you'll know. You can see how red and inflamed my arm is there. You can see my IV site. That's not abnormal for an IV site to look blown like that. And I have I have good veins, but I blow almost every time. This is not normal. And you can see the redness. This is actually much better than yesterday. I'm taking some Augmentin, which is an antibiotic, and they actually put me back on blood thinners for another 6 months. I have a really serious history with blood clots. I had pulmonary embolisms in 2017 that almost took my life, and was on warfarin or Coumadin, which is pretty common blood thinner, for about 8 months post pulmonary embolism, and I was taken off of that. The doctor, I've told you guys all along, knew about my history with blood clots. I had my ICPs, my compression cuffs that I wore, the portable ones on the plane. So the difference between what I have and what is considered to be a deep vein thrombosis, or a DVT, that you have to be so careful about after any surgery, especially if you're flying. Very important to wear compression garments, very important to make sure that you're walking after surgery, because just sitting in your hospital bed can cause a deep vein thrombosis or a deep vein blood clot, which is life-threatening. For me, mine was provoked by estrogen. So birth control, for me, it was estrogen that I was taking post-menopause that caused a clot from a previous surgery several months before to break loose, go to my lungs, almost took my life. 25% of people that have a pulmonary embolism die. That's how serious it is. So when I started noticing the symptoms of this, I got to a freestanding emergency room right away. I was there about 3 hours. They did a full ultrasound of it. You could clearly see the clot on the ultrasound blocking the vein. So there's not really anything that they can do to resolve a blood clot like this. If it caused a heart attack or something like that, they can inject the blood clot and break it up. But with this, they're just going to treat it with blood thinners, let it resolve itself. As long as I'm on blood thinners, I'm not at risk for this breaking off and going to my lungs as much as I would have been if I would have just let this alone. So the symptoms of this that I started having, I had a lot of tenderness, and it kind of moved from in the crease of my elbow to the kind of the bottom of my elbow. There was a lot of swelling, and the warmth is what you need to look for, whether it's your legs, your arms, at your IV site. No matter what, you're going to have like a swollen, tender area, and it's going to have heat. It doesn't have to be super hot. If you have a warm area, usually about this big, that can be a blood clot. You need to go to the emergency room. Make sure that you get treated for that. Make sure there's an ultrasound done. And if you're having any shortness of breath whatsoever, a blood clot, a pulmonary embolism can come on very quickly. Mine presented between my shoulder blades. After I went to the fair, I still believe to this day that a ride shook that blood clot loose. I am not convinced. Now, I was on estrogen too, but I'm convinced to this day that the blood clot threw from a ride that I rode at the state fair. Convinced, because within a day, I was having symptoms. As I put it off for 3 days, I could have been dead. I should have been dead already. But don't put this off. If you're having difficulty breathing, it will normally present with with chest pain, similar to a heart attack. You're not going to be able to get your breath. So shortness of breath, if you're panting, there can be pain for women between the shoulder blades and the back, which I never knew until it happened to me. So just make sure that you're on the lookout post-surgery. You don't need to be afraid, but for me, I did develop one. I've been off blood thinners for a very long time, so it's not uncommon. This type of superficial thrombophlebitis happens in a superficial vein, and that's what I was going to tell you guys, is it's very different than a deep vein. It's not an arterial clot. It's not deep in there, and the likelihood of this breaking off and throwing to any other part of my body is very, very slim, because it's superficial and it's in a vein that's very close to the surface, which is where they placed my IV. So it's not that they did anything wrong. It's that some kind of trauma happened, whether it was an injection of pain medication or something, but the body makes a clot to heal. It goes to a place wherever there's damage or an injury in your body, and then it makes the clot to heal that area. So that's what's happened. You just need to keep an eye on it. If you're having any heat or swelling in any part of your legs, your thighs, it most commonly happens in your lower calves. So please keep an eye on that. And if you're seeing any discoloration in your skin or striations, in my case, before I went in yesterday, I had long streaks of red outside the vein and around the vein, and they were warm to the touch. That's what a striation is. So make sure you get that checked out, because it can be very dangerous. And I went right away. So taking blood thinners is not fun, but I have a bad history with the blood clots, and have had a situation that almost killed me. So that's why I'm taking blood thinners. And yeah, that's the situation. So don't freak out. I'm going to be just fine. There's not any risk when I fly back home that this is going to break off or anything like that, because it is a superficial vein rather than a deep vein. And that's where your issues arise, and clots break off and can go to the heart or to the lungs, and that kills people. So be diligent. Wear your compression garments after surgery. Keep an eye on your body and what's going on, and you'll be able to catch it like I did. So overall, what I've been eating has been really good. Starting off with Premier Protein shakes in the mornings. That's 30 grams of protein. I have Fea 0% Greek yogurt. There's a lot of protein in that. I have to mix it with like a Splenda or stevia though, because I can't just eat it plain. It just grosses me out. And my stomach's able to tolerate that. Normally, you're not going to have milk products until later on, but I'm kind of experimenting with my body and what works for me, and the yogurt has worked pretty well. I was still eating my bariatric soups. I had regular soups last night and today, so that worked out really well. And overall, I haven't had let's talk about the cramping in your stomach for a little bit. I mean, your stomach's basically been cut open and it's been stapled back together. So you're gonna have a lot of cramping in your stomach. And when it's empty, it's gonna cramp a lot too. My cramping is more in the mornings, after I've kind of gone all night without any food in my stomach. But your doctor should give you a prescription to help with that cramping. I think it's meloxicam, but don't quote me on that. I'm gonna have to look at my prescription and I can tell you guys. But there is a drug available that can help with that cramping, because it is excruciating in the mornings. It's very painful. You're getting up on an empty stomach, you're lightheaded, and then your stomach's cramping on top of that. And I mean cramping, it hurts. I'm trying to think if there's anything else I can tell you guys. Going to see the new It tonight with my son. Got a movie date tonight with my boy, which is great. Other than that, things have been going really well. I'll check in the next couple of days, but today is exactly 1 week post-surgery, and I am feeling great, except for this little hot blood clot in my elbow, but I'm gonna be fine. Just be diligent, advocate for yourself, and if something seems wrong or seems off, it probably is. So make sure you get yourself to the ER. Don't wait to call your doctor. There's a lot of freestanding ERs. Unless you don't have insurance, you're just really risking your life when it comes to blood clots, and no hospital can turn you away, whether you have insurance or not. So just make sure that you're looking out for yourself and that you take yourself if necessary. My hair looks really dry right now, and I don't know if it's the difference in the water here or if it's nutrients or what's going on, but I've gotten some Moroccan oil to put in my hair. To me, it just looks and seems drier than it was before. I'm hoping that I'm not going to have the hair issue. I haven't started taking my vitamins yet. I was told not to for 2 weeks because it takes up a lot of space in your whether you've had the gastric sleeve or especially the pouch. Chewing 4 vitamins a day, it takes up space. So he told me to wait 2 weeks post-surgery before I start my vitamins back. I don't have my biotin with me, so I haven't been taking that, but to me, it looks a little drier. Maybe I'm just imagining things, but I'm just trying to be very in tune with my body and the things that are going on so that I can rectify anything that's happening before it gets out of control. So I hope you guys are doing great. Subscribe below, turn your notifications on to follow my journey. I try to post a video every few days so that I can give y'all an update on where I'm at in the process and in the journey. This has been great so far. I'm already down several pounds. I can already tell. I had to buy a new shirt with my son. The other one was just way too baggy, so I bought a shirt while I was out today in an extra large rather than an XXL, which is what I would normally buy. So it's a size smaller, and it actually fits pretty well. Got some cute Converse shoes and stuff like that today. So I'm not buying clothes just yet. I know by October, by the time my trip to Los Angeles rolls around, I'm gonna probably have to have a new wardrobe by then. But it's only been a week. I know I've lost weight just from the way things are fitting that I have with me, and I'm just gonna keep continuing to go. So subscribe, turn your notifications on. I hope you guys had a great day. Bye, talk to you soon.